Hello, welcome. Thank you very much. I'm joining you from London. As we said, I'm the Chief Learning Officer for Fundamental Surgery, and I'm here really to try and talk about teaching, training of surgical residents and the possibilities for technology and how that can help, especially in the new world that we're facing and the real benefits and affordances that virtual reality and other technologies can really have. So what I'm going to do very briefly is just show you a very short video for those of you who aren't familiar with our product set. So bear with me, this is always where it goes slightly wrong. So let's have a look. And it's just to give you an idea about about our product, so we can have a little better idea for those of you who aren't that familiar. So it's a marketing video, but what you can see here is a virtual operating room where you can see a range of surgeons that are connecting from all over the world to look and discuss virtual surgery. So they can beam in from phones, from mobiles, or from virtual headsets, so wireless headsets in this way.
Wow.
So that hopefully is a very brief snapshot, but essentially you're wearing these kind of things, Oculus Quest, or they're more complicated things. You can enter into an immersive virtual environment. You can see the patient in front of you. If you're sitting there or standing there with a colleague from across the continent, like colleagues here, I'd be, love to be in a VR session for you to teach me more around, TKA, because we've got a TKA procedure and also total hip replacement as well. And we'd love to get more involvement and feedback on our simulations. And for me, my passion is really teaching and thinking about surgical residents. So, in theatre, hopefully you can imagine if I was sitting there, one of our esteemed colleagues were coaching me through surgery, you can imagine them using the kind of OODA framework: observe, orientate, decide, act. What are you going to do? Why are you doing it? Let's have a conversation about what might go wrong in this step. What are your preferences on this element? What's your surgical objective? What are you trying to do here? That whole real value of consultant surgeons who are really good teachers, who know how to ask questions, engage trainees in a safe space that can be done in a steady manner from across continents, and also students coming together, trainees asking themselves in groups, talking through cases and understanding the real elements of surgery in an environment where you can communicate, talk, look at the x-ray, and really take people through your thinking process. Because in surgery, I've often spent hours watching loads of videos, and I often try and get the surgeons who I'm working with to narrate and talk through. But obviously their first concern is the patient, so they're not always able to narrate what they're doing and thinking. But in a virtual environment, you can stop, you can pause, you can go back, you can really understand the benefits and the thinking around surgery. And I think this multimodal element, just like at this Zoom web conference, you can imagine 200 residents is being taken through the benefits of the injection that you were mentioning before, and describing how you administer that, where you do that, and what the basis of that is, how you localize the particular area you're doing. All those things are really important. And our, the benefit for surgical residents really is at home. They could be using this kit. They can go into their hospital and use the haptic VR system. So that's when you're using the haptic geo, so you get force feedback. It's amazing when we're working with residents, and you can run Rainger up and down the spine. You can use a sagittal saw. You can feel the reamer. One of the whole, I'll give you a good example I know from TK, total hip replacement, is trying to explain to residents the orientation of the reamer and that feel in the change of tone. And really in VR, you can kind of talk them through the whole orientation and the force feedback, but you can take people through the story of the procedure without that at home, in terms of learning the benefits up front. So there's an amazing potential to scale up and put surgical training in the hands of trainees, and add and do that in a way that really capitalizes on the value of the surgical teachers we've got to really engage with residents across the world. And I think there's amazing potential there in terms of assessment of knowledge and developing new areas, sharing practice. And I think technology in today's world is really showing us there's a real need for that, capitalizing on our downtime when we're not in surgery. How can we really engage our residents? And the last point really is that this is a new world, and we've been saying for ages that the youngest generation are coming through, and this is now in schools. So they're going to be expecting this new engagement and opportunity as well. And there are some added benefits. You can bring up enlarged 3D models in virtual reality. You can highlight stuff there. There are elements in a virtual world that we can have dynamic x-rays we've got going. We've got ultrasound. We've got all these things that really engage you that you can't necessarily do in theatre in a real time on a real patient. So, you know, hopefully, you know, this gives you a little bit of idea. The world is changing and the technology is now getting there to enable good teachers to teach surgery and to enable residents to learn independently and in groups in a safe way that teaches safe surgical practice.